All right, so thank you again for joining us. We are now going to talk about the 2023 session in particular. Now that you're prepared to be a great advocate for medicine, for practicing physicians, for your patients, we now want to delve into MedChi's own legislative agenda and priorities. So we welcome Steve Wise, who is a lead lobbyist with Shorts, Metz, and Wise and Kaufman, to do our presentation today. And he's going to talk about the focus areas for MedChi and really delve into some specific areas that MedChi will be addressing with legislation this year. Steve, please go ahead.
Thank you, Susan. Again, Steve Wise, our firm is Schwartz, Metz, Wise, and Kaufman. We are the law and lobbying firm for MedChi. Each year, through a combination of MedChi's House of Delegates and their Legislative Council, priorities and objectives are established to guide the legislative program of MedChi. The House of Delegates is an opportunity for members to bring important healthcare issues to the body for consideration. And through resolutions, the House of Delegates directs both the Legislative Council, our firm, and MedChi as a whole in what it should be working on, what issues it should be working on, and what positions it should be taking on those bills. Our Legislative Council is a group of well over 30 positions, which any member can serve on. And it is currently co-chaired by Dr. Clement Banda and Dr. Huff. They guide the weekly meeting of the Legislative Council as we consider all of the bills that our firm flags for MedChi's consideration. So in a normal legislative session, there's approximately 2,500 bills that are introduced on every subject you can imagine. We sift through those to identify any that might have an impact on, excuse me, on MedChi and the physician community, and the Legislative Council takes a look at those. Now, that's a lot of bills. It's hundreds of bills every year. And because of that, MedChi has set up a subcommittee system within its Legislative Council. And that's the Insurance Subcommittee, the Public Health Subcommittee, and boards and commissions. And ahead of the weekly Legislative Council meeting, those groups meet and make recommendations to the full Legislative Council. And it's an efficient way of dealing with a large volume of bills that we consider every year. And those fall in, this is a brochure that shows the general guiding principles and legislative program for MedChi. And they fall into four categories, and we'll come back to some of the details here. But the categories are timely delivery of healthcare services and payment, much of that related to insurance, both public and private, protecting access to physician services in the practice of medicine. Those are scope of practice issues, governance by the Board of Physicians, and also tort-related issues, medical malpractice, addressing behavioral health treatment and recovery needs, and strengthening public health initiatives. So the public health can be very wide-ranging as well. A couple of, I'm going to go back to this slide very quickly. A couple of highlights from here, which we'll come back to in a second. Under ensuring timely delivery of healthcare, one thing that we've worked very hard on over the summer is coming up with legislation to address utilization management, which is another way of saying prior auth and step therapy laws and the practices of insurers. A number of years ago, MedChi undertook an effort on step therapy, and that resulted in some changes that were good. But as can be expected, the commercial insurance market in particular has found ways to navigate around that. And we will be putting in legislation this year to address that. Secondly, ensuring that physicians and healthcare practitioners are not excluded from participating on insurance panels. This is an any willing provider legislation, and that was enacted by our House of Delegates. So we'll be introducing legislation on that front as well. For many years now, one of our key legislative priorities has been keeping Medicaid evaluation and management codes reimbursed as close to Medicare rates as we can. And for the first time last year, we were able to get that to 100% of Medicare, which is a big deal. That is not the case in many states. And we will be continuing to advocate for that again this year. Moving down to protecting access to physician services. One piece of legislation we've worked on throughout the interim is the physician's assistants are going to be putting in legislation that will make changes to their Practice Act. That'll be one of many scope of practice bills that we deal with on a yearly basis. In recent years, we've had proposals for the podiatrists to be called podiatric physicians, which MedChi has strongly opposed. Physicians continue to want to do more in terms of providing healthcare than just dispensing. They want to administer vaccines, provide other advice. All those types of things come under this category, and MedChi is actively involved in those. So just to dive a little deeper on those, Medicaid parity is pretty straightforward. We hope to achieve 100% of Medicare on those E&M codes once again this year. Utilization review, again, this is a little more detail on what we're going to be looking for there and what will be in our legislation. Standardizing systems across carriers, requiring carriers to use evidence-based medicine. Most of you know they follow certain algorithms, and they are unbending to particular circumstances of a patient. And even when the physician attempts to provide evidence for what for their decision to deviate, the carriers are very difficult to deal with. We have found that when a patient files an appeal and grievance with the insurance administration, that something close to 70% of the time, the decision of the carrier is reversed. So that tells you that the carrier's decision was wrong. And if it's happening that often, their policies on step therapy and prior authorization are flawed. This is a work in progress, but it'll be a major priority and a major issue for MedChi this session. Any willing provider I mentioned, the thought there is simply that providers should be able to join a network if they agree to provide services in a manner that meets the terms and conditions of the carrier. Scope of practice, year in, year out, MedChi has scope of practice issues, and it comes from all different angles. Podiatrists, pharmacists, naturopaths, all seeking to do things that sometimes are really the practice of medicine. And where it's supported that those other professions can do certain things, MedChi has worked with them to allow for that. But in other instances, it is simply encroachment by other professions into the practice of medicine and things that they are not as well trained for as a physician, and we generally oppose those. In the earlier part of our presentation, we talked a lot about being involved, not just understanding these issues, but putting yourself in a position to advocate with legislators about proposals and legislation that's being considered by the General Assembly. And these are quotes that just sort of support the notion that you've got to be involved to make a difference. MedChi is very good at reviewing legislation, preparing materials for physicians to use in advocating. But if physicians don't actually do it, we've not done everything we can to try to influence the outcome. And all of these quotes go to that. And as the final bullet says, it takes the physicians, it takes the components, it takes MedChi, and MedChi includes our lobbying efforts, but our lobbying efforts are most effective when they're coupled with the actions of physicians, either by phone, email, or a relationship with the legislator to see it through. So with that, Susan, that is the 2023 legislative agenda in broad terms. But we certainly hope people will continue to stay close to it and participate as much as they can.
Thank you again, Steve, for reviewing MedChi's legislative agenda and priorities. The legislative priorities document is available to anyone on this call and to all physicians and to the public in terms of what MedChi is working on. So if you would like that, please see MedChi's website, or we certainly can email it out. Wanted to stop now and see whether or not there is any other question for Steve about the current priorities of MedChi.
I have a question, but I'll defer to our physicians to go first if any of them have a question.
I think you're up.
Can I speak? Can you hear me?
Yes, we can. Thank you, Dr. O'Connor.
I just wanted to say that I told my story yesterday on that prior auth, and I'd be glad to share it in person, anywhere, anytime.
Dr. O'Connor, I heard about that, and we will be asking you to share that often.
You betcha, because you know what? Yes, absolutely. It's very important for people to hear about it.
And we know that many physicians have stories like that, maybe or hopefully not one that is fatal, but certainly we want to capture as many of those as we possibly can. And so I know MedChi as well as Montgomery County are going to be attempting to capture those stories and be able to use those in our communications publicly. So that will be going out very soon in our e-news. Any other questions, Kathy?
Yeah, Steve, my question is the 2.5% federal Medicare cuts. Is there any impact that has on our local efforts for Medicaid parity?
It's a more complicated question than it sounds like, but possibly yes is the answer. Because if the rates are adjusted at the federal level and we're advocating for 100% of that, but the 100% is less than it used to be, it can have an impact on it. Now that 2.5 at the federal level, I think though, is across the board. And of course, here we're talking about E&M codes.
Yes, true. Thank you.
And I think that's an important distinction to make. I know that Dr. Rockauer put in our chat yesterday in our legislative discussion, because I prompted him to do so, that E&M codes are not, they can be used by specialists, but in terms of surgery or procedures or labs or all those kinds of things, that parity does not apply to those. And so, but many legislators don't understand the difference between E&M codes, or maybe we don't specifically say E&M codes, and all those other things. So I think that's an area that maybe we could work on a little bit in terms of our clarification of the issue.
Right. And that's a good point, Susan. Now, the history of this, when we really began to advocate for this, was when the healthcare reform passed back in 2009. And so much of the focus of that was primary care. And that was the tie to the E&M codes. So you're not wrong, but that's the history. In fact, you're very right. The other thing though that gets in the way when you start adding other codes is the price tag goes up. significantly. And so we always have to be conscious of that as we do try to broaden that advocacy effort.
Well, Dr. Ali in our discussion yesterday mentioned that, she runs 2 urgent care facilities. And so she has people come in, and certainly she may be able to bill under the E&M codes, but then she has a very difficult time referring any patients out to specialty care. Because often they cannot, what they do cannot be billed under E&M codes.
Right.
Any other questions? Well, we thank you again, Steve, for being an excellent presenter. We appreciate you being able to do this. We will be capturing this video and be able to repurpose it on MedChi's website, as well as Montgomery County and other components. It'll be available to send out to physicians at will to become a better advocate. And also we can use it to inform them of the 2023 session priorities. So
thank you for the opportunity.
Sure. And one last chance for questions. So we thank you again for being with us today. We understand that you have many priorities. Certainly your patients are priorities. We thank you for taking some time to learn how to be a better advocate and be more informed about MedChi's legislative priorities. We hope you have a great weekend, and we look forward to seeing you again. Thank you so much for your attention.
Thank you.